A very pleasant evening to you out there. Many thanks for joining us on another edition of the program National Talk on Equa Television International. My name is Joyce Jakada, and we're live on Facebook and YouTube. Do well to join the conversation. Tonight on National Talk, we beam our light on Nigeria's healthcare system amid cholera outbreak. The Director General of the Nigeria Center for Disease Control and Prevention, NCDC, Dr. Jide Idris, on Monday at a press briefing on the update of cholera situation in the country, said the country has recorded 1,528 suspected cases of cholera and 53 deaths in 31 states across 107 local government areas, with a case fatality rate of 3.5% since the beginning of the year. He disclosed that experts who conducted the risk assessment last week placed Nigeria at high risk of increased risks of cholera transmission and impact. In the meantime, the Chief Executive Officer of Gavi, Dr. Sania Nishta, in a post on her X handle at Sania Nishta, said that the body was concerned about the cholera outbreak in Nigeria and was ready to support the country in its response. This is even as Nigeria Center for Disease Control and Prevention on Monday said it had activated the Emergency Operations Center to contain the gravity of the situation in the country. Before we go into the discussion, we'd like to listen to perspective from the Infectious Disease Unit of the Bingham University Teaching Hospital. Let's listen.
For some of you may have heard the rumors concerning the recent cholera outbreak. From the information that we have gathered, it seems to have started from Lagos State. There was an official response, and all over the states of Nigeria, we are being sensitized to all be on alert. And then the purpose for this talk to the general public is on the things that we can do to help ourselves. Now, cholera is not a small disease. It is not a disease to be taken lightly. I wish some of us have been opportune to see how this disease presents. It is very serious. Sometimes you see somebody's having diarrhea, and by diarrhea we mean that the person is passing watery stool, all right, and the person is weak. And then you're just tempted to say, oh, maybe it is just the food they ate. It could be cholera. How would you know? Sometimes cholera is transmitted through what we call the fecal-oral route. So in some places where they have streams and they have rivers, and they maybe sometimes it could be a swimming pool, and then you don't know what somebody may have defecated into that water, and somehow that thing finds itself into the mouth of, it could be a baby, a youth or an adult, and all of a sudden they go down with vomiting, they go down with passing of watery stool. Now what happens is that immediately they come to the hospital, we classify it as an emergency. They have to be attended to on time. So now the reason why we're talking to the general public is that there are some simple things that you can do at home to prevent yourself from having this cholera. Like, you know what they say, prevention is better than cure. So you're at home, one of the things you have to take care of is your hand hygiene. All right, how do you wash your hands? You know, when we just talking about washing our hands, there's even a proper way to have our hands washed. Right, wash your hands properly before you eat food, please, because the skin covers the body, but you see, once anything has gotten its access into your mouth, one of the things you can come down with is cholera. I think as at the 28th of April in Lagos State, we had about 14 deaths nationwide, and we had about 815 suspected cases. And so for that, the National Center for Disease Control is coordinating a nationwide response on this cholera outbreak, the recent cholera outbreak. So at home, we'll repeat again, what can you do? You wash your hand properly. You want to know, you want to verify the source of your food and your drinking water. And then at home, another thing you can also do is, if you notice somebody is having recurring diarrhea, that is passing of watery stool, and at the same time the person is also vomiting, please do not try to treat at home. Yes, they are different. In medical terms, we say that the person is dehydrated. There are different stages of dehydration. Some may just respond when you give ORS. A lot of our nursing mothers, they know what is ORS. Some may respond, but some will not respond, especially if that passing of watery stool is caused by this thing they call cholera. Bring the person to the hospital. We know how to attend to them properly. Bring them straight to the hospital. You have either a primary healthcare center, or if they are able to recognize it, they will possibly be able to bring them to a center like Bingham University Teaching Hospital, where we are well able and ready to attend to these patients. You say, what causes this cholera? It is one very bad bacterial organism they call Vibrio cholerae. It is very tiny. You cannot see it with your eyes. That is the more reason why you have to wash your hands. So the message again to the public basic. You don't have to know any big information. You don't have to know any big grammar. All you simply have to know is that washing your hands is very, very important before you introduce something into your mouth. I think that's the much that you need to know. As time goes on, with the directive of the National Center for Disease Control, every other information that you need to know will be passed on to you. But for now, I want you to know that hand washing, proper hand washing, is a defense to this deadly disease called cholera.
About the outbreak of cholera globally or within Nigeria, there are a lot of things put in place in order to control it. Like Ogun State, they have started going to school to help other children to know what to do in order not to get infected. Presently in Bingham University, we have rapid diagnostic tests for cholera, which from the OPD or A&E and EPU and the lab, all these things are kept prepared for it. So we don't want to assume, we want to have a definite record that this is actually cholera against next time. So we have all it takes to really prevent it, because the hospital has given us all of that. So we are really prepared for it in these facilities.
I mean, these are perspectives coming from public health workers of the infectious disease unit of the Bingham University Teaching Hospital. But in the studio tonight, I'm now joined by Dr. Chiemeze Amaku, who is the coordinator of the infectious disease unit of Bingham University Teaching Hospital. Good evening and welcome to National Talk.
Thank you. Good evening. Thank you for having me.
Well, it feels good to have you despite your busy schedule. I know that for some time now you've been busy, especially at your unit, drawing from the outbreak of the cholera and in line with preparedness and directives coming from the NCDC. And I must really appreciate you for creating time to come here and speak to us on Nigeria's healthcare system amid the cholera outbreak. But quickly, we've heard from the NCDC Director General, Dr. Jide Idris, talking about the outbreak that was on Monday during a press briefing. And we're made to understand that this cholera outbreak, which we saw amounting to about 1,528 cases as at Monday, has also recorded 53 deaths in 31 states across 107 local government areas, with even a case of fatality rate of 3.5% since the beginning of this year. And people have been asking questions about what is this disease and how can we be safe from it. But I would like you to just give us perspective, like can you break this down for us and help us understand what this disease is all about, cholera?
Okay, thank you very much. You want me to break it down, so I'm going to break it down.
Please do.
Cholera is an acute diarrheal disease. When we say acute, it means it just comes up suddenly and it doesn't last for so long. It can kill within hours. It's an acute diarrheal disease that is caused by the bacteria Vibrio cholerae. That's actually what causes it. And then for this particular disease, it can kill, like I said, in hours. The major problem with the disease is that it's transmitted through the fecal-oral route. When we say fecal-oral route, it means that it goes from the feces to the mouth. So in other words, if you see anybody who is diagnosed to have cholera, it means that at one point in time, that person has ingested feces. So it can be transmitted through the things, whatever it is that gets into your mouth. It can be water that's contaminated with the organism. It can be food that is contaminated with the organism. It can be when your hands are not properly washed, especially after you've attended to either the toilet for your own self or for a child who may have diarrhea, or through any other source, but that hand was not washed and then it went into your mouth. So there are several things that can, whatever it is that can make that thing get into your mouth, it can give you that illness. You have an incubation period of certain days, but before then, once it manifests, that's where the patient begins to show symptoms. And then some of the symptoms, like I said, is a diarrheal disease. It's when somebody passes profuse diarrhea. The person can sit down and then it just goes, it's not like dropping. It can, like when I say it can kill in hours, the person just loses so much fluid because of the toxin of the Vibrio cholerae. So it goes into the system, gets into the small intestine, and then starts causing problem. Instead of the small intestine to be able to absorb the fluid that the body needs, it's not able to do that because the toxin of that organism has prevented it from doing so. So you see all the water that is in the system of the person being drawn into the intestine, and then it just passes out through the anus and just goes out that way. So if it's not replaced, depending when the organism has been taken care of by an antibiotic agent, that person will most likely die from dehydration, from shock, and from other complications. So that's actually what cholera is all about. It's quite fatal for those who will come down with it. We're told that in 10 persons who are exposed, one will get, that's 10% of the total number of persons who get exposed will come down with the severe disease. So that's what actually happens. So if you see that you have 10 persons who have come down with disease, it means that 100 of those people have been exposed to it, and then for about 10 to come down with that disease.
You made a lot of emphasis as regards the cause of this cholera outbreak. And Nigeria as a country, we know that when it comes to open defecation, like I think we're ranking like second in the world, and that's to say about 60% of households like don't have like toilets, clean toilets around them. Like people just engage in open defecation, and with the raining season and all of that, it contributes to that as well, because people have made emphasis on the breakdown also of water sanitation and even hygiene, because we just have barely 19% of Nigerians having access to just clean water. And that means the rest of Nigerians have to resort to either digging of well, borehole, and at the end of the day you're just taking water that is not really clean and all of that. We've seen pictures of people resorting to streams, to rivers, and they just take that. And of course that can also be linked to the widespread. But I would like you to just pick on, we've heard of these figures and it's not stopping there. As at Monday it was 1,528 cases, but as at today it was like 1,579 cases. And given these numbers that are actually increasing daily, and the NCDC saying that placing Nigeria at high risk, I don't know if you're worried about this outbreak, especially that we're in a time where it's raining season and school is also in session, and daily there's like an increase in the number of those that are actually infected. Like, I don't know if you're worried about that, and more of concern the fact that school is actually in session, even though we've not heard of like cases around schools, but the fact that it's raining season and school is also in session.
Well, it's actually quite troubling. If you look at it in a certain way, you know that these figures most likely will keep rising. That's why I'm saying it's quite troubling. One of the things that we are supposed to do is to pass across the information to those people who don't know about it. But how many of these persons have access? Now, we have insecurity in the country. And one of the risk factors for this will be when people are in a place clumped together. Go to the IDP camps. How much water do they have? What's their water source like? Yes, school is in session. Even those people go to school too. I believe some of them go to school, some of the children. So what is the water they're drinking from? So even if you sensitize, yes, it may, and they get to hear about it. Getting to hear about it is something very, very important. So how many of them have television? How many of them have radios? How many of them even have the power source to put on these things? Because as it is now, you know how much you pay for electricity. So, like I said, it's quite troubling that it's going to actually rise for some time. Maybe after some time, by God's grace, it will start coming down. But then the issue is that when you have insecurity and you have people being chased from their own local communities and they go to IDP camps, how many of them have water sources there? That is one. And then you look at this instance, we have children, like you've said, going to school. This is the rain season. We have flood in some parts of the country. The meteorological lesson of Nigeria has been saying these places are flood prone. But most people are still not adhering. Some are not moving. They will tell you, I don't even have where to move to. Now, these places are places that once this flood comes, the open defecation you mentioned water carries this physics into your very domot, like the Nigerian parlance will say, your very presence. You don't even have enough water. When the flood comes, even if you have pipe-borne water, you are not able to have access to it because the flood has covered everything. You are forced to drink water that is contaminated. So even with that, you have flooding, you have this problem. You also have, how many of these places actually also have health centers? You go to some of them, they're just empty buildings. You don't see people who will take care of you in that place. In some of those places, you don't see doctor. You've heard of Japa syndrome. So in some places, you don't see doctors enough. It's good to know that it's not only doctors that can treat this. Other healthcare personnel can do, but how many of them would you find in those places? So there are several issues. There are several things that will make these figures to keep rising. But NCDC, they are trying, having taken the step they've taken. We want to see how well it's going to help us. But for now, like I said, it's quite troubling because I believe that with several things that we're going through, this is going to keep rising for some time before it now
talking
starts
about
coming down.
the fact that this is going to keep rising. Is cholera contagious, and what are the primary conditions for, if it is, what are the primary conditions for contracting this disease?
Well, let me go this way. You remember I said 10% of those who are exposed come down with the disease. The problem is not as if it's by contact, but if I have it, you touch me and then it passes to you. No, it doesn't happen that way. It still goes through the fecal-oral route. So if I have it and you touch me and you didn't wash your hands very well, you could contact it. That's the normal way it goes. So if you have an area of, you have a certain number of persons who have come down, you were asking whether it's contagious and on what again?
Is cholera contagious?
Yes.
Yes. If it is, then what are the primary conditions for?
Okay. So I was now saying, so I had mentioned some of them. When you don't wash your hands after having been exposed to things that will cause the disease, that's one. I was saying initially, if you have somebody who has it, there are others who are exposed to it who may not come down with the sickness. So it's very troubling because those people will still keep transmitting. They will still pass the Vibrio cholerae in stool, even though they're not down with the illness. So they look normal, they look fine. So if you take it lightly that these ones, they've gone to the toilet and they've not washed their hands, and since they're not lying down on the bed, you can touch them. So when you have contact and you didn't still wash your hands very well, you can have that. I had mentioned the thing about climate change, where you have flood. When you even have drought, it means that you don't have enough water. And once there's not enough water, then the problem will be there that you won't have enough water to drink. It's a problem of poverty. That's cholera. It's a disease of poverty. When you have poor sanitation, we've mentioned open defecation. Even when you don't have, even when you have a place to defecate, and then it's close to a water source, it's less than 30 meters to a water source, there's a very strong likelihood that you should contaminate that water source, and those who will drink from there will also drink from it. That is, the proximity to the water source can cause that. So there are several instances, yes,
because we even live in a part of the country where people find shaking of hands as normal. I remember during the COVID-19 how that alternatives were made, just shaking from distance and over. Still, people find it very hard to even adjust to that. People just meet and they just shake. And I think this is another way that you could just get this, especially if the person has contacted it and you are also shaking the person immediately. It's another means of actually contracting this. But let's speak about the widespread now, because it started like in Lagos and we saw Ogun, we saw other states. Now we are talking about this over 1,500 cases across 31 states, 107 local government areas, and look at the fatality rate at 3.5%, like even beyond, way beyond the regional expectation, which is around 1%. So this is just Nigeria. I'm really worried about the spread, because it just started like a joke from Lagos, and we saw Kano, we saw Ogun and other states like coming up. What is leading to this widespread across like the states in Nigeria? Because for some countries or for some regions, this issue of cholera is something that is like long forgotten. But we first heard about cholera in Nigeria historically, 1972.
1972, yes.
But between 1972 to around 1991, more like there was like reduction in the cases. But this is 2024. We expect that even if we're talking about, like, to some extent, we'll have long dealt with these issues. But in 2024, we're still talking about cholera and the widespread. Like, this is becoming or is already an endemic disease. So what is the cause? What is the reason why we're having this widespread across the country? Because why people are just talking about Lagos, the next day you're hearing another state reporting of cases and all of it. Why do we have this widespread?
The world has become a global village. It's smaller, not in size, but it's smaller than it was before. People can more easily travel from somewhere to the other place. I had just mentioned that there are some who are exposed to it, but who are not down with the disease. Of course, these also travel. Lagos and Ogun are just very close, they're not far. So you could have those who have been exposed or infected traveling down to Ogun State. And of course, if they are not used to open defecation, for example, or they don't know how to wash their hands appropriately, properly, they can just do their hands that way, but they've not washed it properly. You've just mentioned the handshake. Oh boy, how far? Everybody just shakes. Even when we talk about some other country, you see people sneeze. I believe in God. Oh boy, how far? That same hand. So it also happens with cholera. Somebody goes into just branches somewhere, one open place, defecates, and then cleans up, and then comes. No water, no alcohol hand drop to sanitize the hands, and then the person comes and shakes you. Of course, it means that you automatically would have contacted. It depends on whether your immunity is strong or not for you to come down with it or not, especially if it enters into your mouth. So this movement from one place to the other is one key element that I'm thinking is making this happen. But then, if you look at the number of persons we have now, is much more than we had in those years. You have more people now clustering in a particular place. You have more slumps now than before. So you have this thing going up. Look at climate change. It's also worsening. It's making floods, like we talked about. It's making the droughts. It's also adding to this thing coming now. Look at poverty. This is a disease of poverty. Can you look at the country? See how poor people are. If somebody could drink a bottle of water, some people will now resort to pure water. Those who could take pure water now take any water, maybe well water. Those who took well water will now resort to whatever. So the poverty is increasing in the land. And so since this is a disease of poverty, it worsens. So we are thinking it should be getting better. But look at us, look at where we are. Look at insecurity, like I mentioned. You see people who are chased, and then you have several more IDP camps now than you had before. So you have this overcrowding, and so this overcrowding also exposes people to this kind of disease. Because if you have them in a particular place so much in number, somebody gets infected, it's easier for several others to get infected than when overcrowding is not there. So these are issues that are making these things worse, even though they should look better now, but we find out that it's worsening.
Like, I'm just wondering why in 2024 somebody is building without toilet. I'm just wondering why, like, in 2024 we're still talking about open defecation. I mean, this will just take your mind back to government policies and even supervision. Like, before now, we have people that go to, like, when we talk about days of sanitation, they go down to people's houses to check and all of that. But today, people just go, like, anywhere, they just defecate, and all these are contributory factors. But I would like you to just speak to, are there particular foods that maybe one is likely to get this from? Because I've heard people say, oh, you need to avoid the likes of zobo, kunu, tiger nuts, and all of that. How do these things translate to some of these food, and then at the end of the day, people eating and then getting cholera?
Okay, so these drinks we are talking about, let me start with that, are made with water. And of course, when you use contaminated water, you've just sold the disease to as many people as will take those drinks, the tiger nut drinks, the zobo drinks, and all these other local drinks. We're not asking you not to take zobo drink or those drinks, but you have to be sure of the source of water. Because once that water is contaminated and it's used to prepare those things, it means that you are invariably just buying the disease with your money and taking it. So if you must take that, first, be sure of the water source. If it's clean, if it's what you are supposed to take, then you go ahead and take. But once that water is contaminated, there's a problem. The person who's preparing it, if the person doesn't have good sanitation habits, the person may be one of those who have the organism, the cholera, but has not come down with it. And of course, he or she will still be strong enough to prepare. And then if the sanitation habit is poor, the person goes and then comes back and continues. The person may even wash the hands, but not wash the hands very well, and then continues. So the person feeds the people with whatever he has brought out from the toilet. That's one way. Fruits that are not well washed can also transmit the infection. One thing you have to understand that some fruits are grown with manure, and some of those manure, if they are fresh before they were just harvested, could contain some of these organisms, the Vibrio cholerae we're talking about. So if those fruits are not well washed, because you know in some gardens they use manure, and so if it's not well washed, not well prepared with salt and water, then there's a strong likelihood that you could pass it to anybody who is eating it. And then it's advised that, of course, you should try and peel the fruit yourself if you have to eat the fruits. So that's one way you could get it. Vegetables are a very, very likely and strong sources. So you have a source, so you have to also wash it with salt and with enough water. But that's where the problem is. When you don't have water and you're washing with water, you may be washing with contaminated water. So that's also where the problem is. So those things that go into our mouths, or the hands that we used to put into our mouths, once they're contaminated with these organisms, that's why we have problems.
You know, it's raining season and it's the farming season as well. Like, we've had cases of farmers going to buy feces from people's sock away and then taking it to their farms. And you just spoke about vegetable. I don't know how safe is that, because like people tell you, no, this is a very good source of manure and all of that. So the relationships now between...
Yes, it's actually a very good source, but it's supposed to be composted. This is not, it's not supposed to be you pick it from there and just go and dump it into your farm. It's supposed to be prepared in such a way that this organism we're talking about now won't even survive by the time you've taken this thing. Moreover, you're not supposed to take it directly from wherever, the toilet or whatever, to put direct. Yes, it's supposed to be prepared in such a way that these things would have been taken care of and then sold or given to the farmers to use as manure, as compost. So if that is not done and it's taken directly from that place to that place, then that's going to be a big problem. That's where there's a very strong likelihood of transmitting these organisms from the toilet or whoever to the persons who will eat those food later, the plants that have come out of it later.
I'm just really wondering that in a country where only 19% of the people have access to clean water, so if we're even talking about washing of all of this, how do you actually know that you're not using the cholera to wash the cholera? But then I would like you to just speak to us on the symptoms, because I've heard you over and over again reiterate how that sometimes people contact this without even knowing that they have, because it looks like about 80% of them don't even show the symptoms.
Yes.
Barely 20% show symptoms. So in a situation now that, like, what should people look out for to know that, okay, I'm possibly having this cholera and I should go to the hospital?
Okay, so we call them symptoms like you mentioned. One of the things, the commonest, is diarrhea. When you start passing waters to, especially when it's profuse. I just mentioned that when we say watery, we're not saying soft too. We mean like water. That's what water means. So it just comes like that, especially if it's coming that way. Then that's one thing you should look out for. We call it rice water stew. But you don't have to wait until you see the rice water. Yes, before. It's not rice actually. That's rice water. You know the color of rice when you're boiling rice and you're washing it. Yes, that color that you have with some whitish particles inside. That's what you see. But you don't have to wait for you to see that before you start thinking this may likely be cholera. So when you have rice water stew with profuse diarrhea, that's one thing you have to look out for. Or there is vomiting. There may be vomiting, there may not be vomiting. It's something. For some, you have fever. For the others, you have dehydration. Dehydration shows itself by you wanting to, well, let me not say you.
No, it's the person infected.
Yes, by the infected person wanting to drink so much water. And then the person becomes weak. Sometimes the person may be having some cramps because, of course, the person has lost some elements, some elements, yes, and then you start having some muscle cramps. These are very common things that you can have. Dizziness is also part of it that people feel. They feel too weak to stand up, to even sit, so they are just most times lying down.
You talk about the fact that it's very fatal, and it means that when it happens, one can even die like within some hours. So are there home remedies that one can resort to before getting to the hospital in situation where like it just occurs and you're stooling, and like are there home remedies, or one must definitely just find a way to the hospital immediately?
Yeah. If you can find yourself to the hospital immediately, please do. But there are home remedies. One major thing about cholera is that the person who has the disease loses water. So what you are trying to do is to see how fast you can replace the water that's been lost. So we have the ORS, the oral rehydration solution that you can give. We have them in packs. So if you don't have the ones in packs that are already prepared, you can prepare the ones from the house. What you need for that one is salt, you need sugar, and then you need clean water. For the salt, you get half a teaspoonful, half level of that, and then you have 6 level teaspoonfuls of sugar, and then 1 liter of clean water. Clean water. So when you get that, you mix it up together and then give. If it's an adult, let the person drink as much as he or she can drink. Then as you are doing that, you watch the person. If you can still get to the hospital, fine. And then report, this is what I've done, this is what has happened, and this is where we are. If you cannot get to the hospital, you may just watch the patient to see whether the diarrhea stops, but you are advised to get to the hospital. That's the best thing you can do while you are still on the ORS.
All right. So can you speak to us on the country's preparedness for this cholera outbreak? Because like the cases is increasing. Now looking at our health care system in Nigeria, like it's either we're having nurses on strikes, doctors on strike. Earlier you were mentioning the Japa syndromes, like we have doctors moving out of the country. That looking at the number of the cities, we're over 200 million. And then the healthcare system generally in this country and the preparedness to curb this outbreak. Like, what do you make of it?
To be candid with you, we have a situation in our hands. We have a similar epidemic, but we don't have enough on ground to take care of it. But like I said earlier, you don't need just doctors to take care of it. It's something that looks somewhat simple. And then you have some healthcare workers who will be added. NCDC has actually taken the bull by the horn, and then we have the emergency center, and other states are now taken from NCDC.
Sure.
So it depends. It behoves us now to say, okay, this is what we have. What is our role? The truth be told, we don't have enough doctor to patient ratio in Nigeria. You don't. You have one person taking care of hundreds of persons, which shouldn't be so. I mean, as per doctor. So it's difficult for a doctor to take care of if this thing becomes a real epidemic in Nigeria, as it is, with every state having so many people coming down with this. But as it is, if we have started earlier, the states who have, like in Plateau State, we've not recorded anyone as it is now. But if we are preparing ourselves, just like we are doing in the hospital where I work, in Bingham University Hospital, where we've collected some fluid, we've collected test kits, we've collected, we are preparing people's minds to know that if somebody comes with this is what you're supposed to do. If we can nip it in the bud, then it means that we may not have so much. But if we just relax, as sometimes we do, it's going to be a big problem. Nigeria may not be prepared for what we're going to have. It's just like it happened in COVID. We had several people talk about it, but when it started coming, we were not prepared enough for what it's like. So if this is going to be like what happened in COVID, there's going to be a big problem. But we pray it doesn't get to that level. Let's see that this early preparedness we're talking about now nips some of these things in the bud, and then it won't get to that aspect. But if we're looking at it the way things are, it may be a bit difficult for us to say we're ready for this.
Okay, like you rightly mentioned, the Director General of the NCDC actually talk about government effort, especially in coming up with the emergency center, and we saw other states like touring the same path. Lagos, for example, I think the Commissioner of Health was talking about how that the cases have reduced now because of how, like, I think they were up and about, especially in curbing this whole thing. But I wanted to speak to how fatal cholera is and what precautionary measures people can take, because if this becomes an epidemic, like you rightly mentioned, it might be difficult for us to contain it. So are there proactive measures that we can take to combat this, or to like reduce or bring an end to all of this?
Yes, there are, but then I won't start by saying government should, because it's something that everybody has a role to play. If we're going to be proactive in this, we'll start with the individual. We should develop, first of all, a good sanitary habit. We should be able to know what can transmit from where to where. If I go to toilet and come back, I should wash my hands. I should know how to wash my hands appropriately, and then I should know when to wash my hands. Before, after, I should know all those things as an individual. For me, if you look at the community also has a role to play. What are the people, the community leaders doing? Have they heard of this thing? Are they calling people around to say, talk to us about this, teach us what this thing is? Are they saying, okay, let's see, we know we don't have pipe-borne water, but this is what we have. How can we go about it? Are we going to have rules to say, if you defecate here, we'll do this to you, because we know that this is going to cause problems? So the community should also stand, because they're supposed to be them taking up this. And then that's their own aspect. How we get to the government now, after having done our own parts. So are they helping us to sensitize the community, the nation, to say this is what is happening? Are they making adequate arrangements for drugs, for vaccine, if there is in this country, for fluids, for doctors, for health centers? Are they making adequate arrangements for all of this? So if we're going to be proactive, these are the things that we're supposed to do. But like I said, everybody has a role to play. That is the way I think it can be gone about.
You know, we have generally an attitude of reacting to situations when we can actually be proactive, because right now we're talking about how that this thing is spreading, and then the cases are actually increasing. And I like the fact that you pointed to individual responsibility, because in such cases you hear people say, government need to do this, government need to do that. Even though I know on the part of the government there are things that they need to work on. Like I was saying, some years back, there's this group of people that they call Dubangari. They go to houses and they check your toilet sanitation or toilet hygiene and all of that, because and you ensure that when there are buildings, when there are structures, when there are shops, that toilets are there. Because if there are no toilets attached to shops or complex or buildings, it means that there's going to be open defecation. I mean, how can we have 60% of households like engaging in open defecation? I mean, it's a whole lot for the country. An individual can decide that I will be responsible in terms of taking care of my environment and all of that. But we are talking about rainy season and how water can just take things to different places, talking about access to clean water, which is one of the major issues. Just 19% is poor, and in that aspect I think the government also need to do a whole lot. But on our own part as individuals, as you rightly say, there are some personal hygienes that you need to imbibe, like beyond COVID-19. During COVID-19, people were so serious about a lot of things. People work with hand sanitizers. People are mindful of shaking hands. But it's like now we have gone back to who we used to be, and even neglecting the personal hygiene that people should just ordinarily. You don't even have to wait till you go to toilet before you wash your hands. Like it's something that should be part of your life. So I would like you to speak to you just touched on that community and individual role. How do we start it from even the family front? Because cholera outbreak, like you rightly established, is like cholera itself is fatal. Like it can just kill. Now we have already recorded 53 deaths, 31 states. That means like we just have 5 states.
Yes,
And
yes.
how safe are we when we have a system where people are traveling daily, people are into business and all of that? So what deliberate effort, and how can we start this from the home front?
Okay, so when we talk about the home, typically we're talking about the father, the mother, and the children. We can have other things, but whatever starts at home, they say charity begins at home.
Sure.
It depends on how you present it to members of the family. As the father or as the mother, you have children. Have you taught them to wash their hands after going to toilet? You can make it seem like a game. You can make it seem like anybody who does this gets a prize from me. But it has to be something that you want to become part of the members of the family. And so when these members of the family get used to the fact that they have to wash their hands after going to toilet or before eating or after this or after that, then that's a way forward. You can also sit them down and let them know, as per members of the family, that there is an outbreak. We have this happening. This is what, give them the, educate them on that particular, as much as you can as a father. Of course, when these things happen, we know children can have cholera. And you know, children may not understand exactly what you are talking about. But then, if you paint it for them in the picture that they will understand, they will now follow and say, okay, if I eat without washing my hands, I'll go to the hospital and they'll give me injection. I talk to my children that way. And then I say, do you want injection? They say no. So as small as they are, they're understanding the import of some of these things. So when one doesn't wash the hand, the other one come and say, Daddy, this one didn't wash her hand before. So it becomes part of the, so when you give them the education at the level they will understand, then that is one way to go about letting them know that these things are issues. But as they get used to it, as they go outside, they tell their playmates, when the playmate goes and does something and doesn't wash, I say, you don't wash your hand, my daddy will beat you. That child learns that he should wash the hand. So it goes on that way. In some time, if everybody continues doing this, then you know that a lot of persons will know that this is actually what is supposed to be. It should start in the home. But some of those homes, when they don't have toilets, how do they start? If they pass through and the mother or the father who doesn't know just does anything, cleans up everything and clean the hand and then continues, you're not able to teach. So first of all, the parents or the caregivers or those who are the heads of the family should know that this is the problem. This is where we are. And then they should go ahead to make sure that the members of their family are carried along. They understand what you're talking about. And then when the news is on and you get an information, you can just quickly say, this person, this person, 20 people have died, 10 persons have died in this state. We don't want it to get to our own place, do we? They will say no, especially if they are small children. When you have bigger children, you tell them exactly what the problem is. Let them know that if they do this and they do that, this is what they're going to face. So even when they do it at home, as they go outside, they also have that culture that they've already learned from home. And then they're able to do whatever it is. Look for a way to pass the message across to those in the home. So that as they go out, they're able to do the things that you've taught them. If it's in terms of this cholera thing we're talking about now, then most likely it's not going to be as fatal as it's going to be. The fatality is that it can kill in hours. It's not like something that's why you say it's an acute thing. It's not something you say, okay, he has this, and then the person keeps waiting and passing. In hours, the person just dies. So the earlier we do something about it, especially from the home front, like you said, the better for everybody.
All right. No doubt government is already on top of the whole matter, the emergency center, like preventive measures, but how can they improve on their efforts so that like we won't be talking about this in years to come?
Well, one major thing that should be done is surveillance. Surveillance shouldn't be when we have an outbreak. Like now, the NCDC, they've ensured that this happens, and states are borrowing a leaf from them. Surveillance, somebody passes waters to, and then comes to the hospital, we report. We have one person, a test is done and it's confirmed. The person information flies, is sent to the following the hierarchy until they get it. This is what we have gotten. Surveillance should continue even after the outbreak, so that once it's picked early, then it means that we can stop it from spreading. So when there is no surveillance, then it means that there is going to be a big problem. It will still come up again and then take us unawares, just like it always does. For let me not say it always does, but most times it happens that way. So the government has started with that. Surveillance is everywhere now. Everybody's looking out for acute watery disease. But then it should be even after this period. Let it be. Those who are involved should be encouraged. I have some people who I work with who need to go from one place to the other, but they will complain, I don't even have enough money to go from this place to that place. But yet I'm expected to go and get information, get this from this hospital, get this from this hospital. But the incentive they were given, let me call it incentive, they were giving some 3-4 years ago is still what they are giving them. That is even when it comes. So these people are not encouraged. When you pay, if you want to use keke, for example, that's the public transport. If you used to pay 15 naira from somewhere to somewhere, now that place is like 200 naira. And when the money comes, if it comes, it's still that same amount. It's not going to help you do anything. And then when somebody sees that I'm going to spend out of my own pocket to do this work, the person becomes reluctant to do it. So the surveillance we're talking about will not work. So if whether surveillance or whatever the government is doing, if there are people who are doing it, let them be encouraged to do this. That's one thing that they are doing that needs to be improved upon. But then what is happening now should also continue. Is the government making any effort to keep medical workers around? Because as it is now, I've not heard anything about getting more doctors in Lagos. Maybe they have enough. I don't know. But there should be things put on ground to make sure that the persons whom we have gotten will not run away because they were not cared for, or because they will be kidnapped, or because whatever. The government should ensure that these people who do this work should be safe in their places of duty. So that's one thing too that they have done now, or they should do now, so that in future we'll not have this kind of thing repeating itself, because we don't have people on ground to take care of these issues. What else is government doing? We have the IDP camps. The security situation in the country is bad. I'd mentioned the IDP camps, which is the security problem that drives them to the IDP camps. Sure. If there is a way that the government can improve on security, fine. We'll look at water. You've mentioned this. You've also kept singing it like a song, that we have just 19% of the population in Nigeria. So what is the government doing about it? Most people that have water is from their own efforts as individuals. The pipe-borne water that we're supposed to have from this other place, is the government actually helping? If you go to those places, they will tell you what their problems are. How far has the government gone to make sure that this... somebody just mentioned that they're giving some tanks. I don't know how true it is, and then they'll attach it to your roof, and then it just fills in. Then, so the person was saying, if this is government doing this, it's not going to take the whole... They can't do it for the whole community, for the population. And if that is what they're doing, this is rainy season. So what of dry season? What are we going to do? I don't know who actually is doing that, but what I'm trying to say is that we should have a means of getting access to clean water for us. If we are trying to be prepared against this, we should also have, because if we have clean access to clean water, then we shouldn't be having problems of cholera in this way. So there are several things that the government can do more. If they keep on doing that, then most likely we're not going to be having this kind of problem in future. Yes.
You know, some people have talked about government's partnership with international organizations to bring an end to this, because we've seen how that in some countries, this is history now. Issue of cholera is something that they have dealt with, and it is no more. And that's why earlier I mentioned how that the chief executive officer of Gavi, Dr. Sanya Nishta, like in her Twitter handle, posted that they were ready to support the country in this situation, because we have been rated at high risks and all of that. So what do you make of the possibility of vaccination, and also maybe partnering with some of these international organizations to maybe ensure safety of the citizens and an end to this?
Yeah, but that's actually a way to go. There are some things you cannot just solve on your own. Just like as it is now, it's going to be a bit difficult for Nigeria to say it's going to solve this problem. So partnering and having partnerships is actually a good way to go about it. These ones will come in and do some of the things that you're not able to do. You've mentioned vaccines. We don't have the vaccines that we use for cholera. We don't have them in Nigeria. They're not part of our routine immunization. And they're expensive, especially when you consider what dollar is to naira. So these ones, when we have partnerships with them, they can bring this in as part of their own contribution to what we are dealing with. It's something very possible. We can partner with some of these organizations too to help with water. Even if it's not the normal pipe-borne water, even if it's borehole, for example, we should be able to get it, boil it, filter it, and drink. It should be clean enough, not giving us all these problems. So you can also partner with them. What of the gutters? Some gutters are not in some places where they're supposed to be. So you see flood when it comes, you see some places being eroded, and then of course all this carries the organism we're talking about. But then if we can partner with some of these people who will, as gradually as they can, help us with some of these things that we cannot do on our own, that will make sure that these things, like the flood, if we have gutters, ideally we should be able to provide gutters for ourselves. But what I am trying to say is, if we can partner with anybody, any group of individuals, any institution that will help us in one way or the other to say, we're going to do this for you, then I think it's a good way to go. Like I said, it's actually a good way to go. The vaccines are very important now. If we can partner, we should be able to have some to save some lives. Because the truth is that the problems that we have are not some things that you can easily remove as it is now. It will take some time before those things get cleared out, but we can mitigate the effect of some of these things. And so vaccines will actually help us, especially for those who will not react to them. It will help us.
Well said, well said. Thank you so much, Dr. Chiemeze Amaku, for your perspective on National Talk. Really appreciate you. Indeed, health is actually wealth. Thank you so much for creating time to speak with us on the program. And to our viewers out there, we hope that you learned a lot, especially as regards this outbreak. Remember that cholera is indeed fatal, and when you experience any of the symptoms like stooling and then feeling of dizziness or vomiting, you should visit the hospital immediately. And at this point, we draw the curtain on National Talk until we come your way next week with another package. You stay blessed.